Good afternoon, and thank you for joining the OC Forum. Today's program is brought to you by our sponsors, UCI and UCI Health. My name is Georgina Maldonado, and I am the Executive Director at Community Health Initiative of Orange County. It is my pleasure to be your moderator for today's discussion. 2 years have passed since the pandemic started, but the words COVID-19 and its variants continue to cause anxiety and fear. Despite restrictions being lifted, psychologists are still reporting high stress levels among Americans. In addition to post-COVID blues, financial stress is high among younger populations and minority groups who report feeling the brunt of rising gas prices, housing costs, and inflation. As you may know, May is Mental Health Awareness Month, and as we navigate the challenges that lie ahead, today's panel of visionary leaders will discuss how we can support each other to relieve these ongoing stressors at work, at home, and in public. I'd like to begin by introducing our guest speakers for today. Joining us, we have Dr. Roseanne Cohen-Silver, Vice Provost of Academic Planning and Institutional Research at UCI. Welcome, Dr. Silver. Next, we will have Dr. Pamela Hymell, Disney Parks Experience and Products Chief Medical Officer. It is my pleasure to have you here with us, Dr. Hymell. Joining us from Cigna, we have Peter Freeberg, who is a Behavioral Clinical Account Manager. Thank you for taking the time to be here with us, Peter. I greatly appreciate it. And finally, we have Dr. Lauren Brand, Executive Director of Operations from Be Well OC. Dr. Brand, it is a pleasure to have you with us here today. Before we start our line of questions, I wanted to ask each of you to share with our audience a little bit about yourselves and what you do. Dr. Brand, let's go ahead and start with you.
All right. Hi, everyone. My name is Lauren Brand. I'm a clinical psychologist, and my specialty area is working in settings that provide innovative programs and treatment for people that have mental health issues and that also struggle with substance use disorders. My role is the Executive Director of Operations for Be Well OC, which is a movement in Orange County to transform the mental health care system and to provide a system of care that is easier for people to access and that provides the right care at the right time. So my specific role is to oversee the Be Well campuses, the first, which is in the city of Orange, that is open right now. And as we expand and provide services like this in other cities in Orange County.
Thank you, Dr. Brand. Dr. Hymell, please.
Yes, I'm Dr. Pamela Hymell, and as mentioned, I'm the Chief Medical Officer for Disney. I'm board certified in internal medicine and preventive medicine, occupational medicine, and I'm responsible for all of the health services and well-being strategy for our cast members, that's what we call our employees, who work in our theme parks, our resorts, hotels, our Adventures by Disney, National Geographic, and our Disney Cruise Line. So it's a great pleasure to be here today.
Thank you, Dr. Hymell. That is such a great responsibility and honor to have you here today. Peter Freeberg?
Hi, yes. I am a licensed mental health therapist and I work for Cigna. And my current role, I serve a number of different functions, primarily of which is just to assist our accounts and clients just understand behavioral health. So I go over behavioral health trends and how we can meaningfully change the conversation of behavioral health within their organizations, hopefully to reduce stigma and get folks to appropriate care as necessary. So primarily, I consider myself a mental health advocate, and it's a lot of fun, particularly the last couple of years with all of the needs out there.
Yeah. Thank you, Peter. That's it. I mean, working for Cigna it's so exciting. Having the perspective of a health plan, I think, is critical in this conversation. And last but not least, Dr. Silver, can you share with us what exciting things you do at UCI?
Yes, hi, thank you. I am professor of psychological science, public health, and medicine. I am a research psychologist, and I am also vice provost for academic planning and institutional research at UCI. And for over 40 years, my colleagues and I have studied the impact of loss, collective trauma, natural disasters, infectious disease outbreaks, and mass violence events.
Wow, thank you so much. It's such exciting work, and I'm glad we have you at the helm of the changing environments that we're currently living in. So, thank you everyone for being here. And so, let's go ahead and dive right into our first question. Okay, so what are we noticing right now? For example, what are the experiences being reported at work, at home, or in the public? Dr. Brand, do you mind taking the stab at this first?
I'm sure. Yeah, we're seeing some of what you would expect, and we're seeing some things that are unexpected. Primarily, the thing that people are struggling the most with is something like pandemic exhaustion. And we're seeing a lot in the mental health community and really just in the general community of signs and reactions that are similar to what we might see in people who've actually experienced prolonged trauma. Things like sleeping issues, eating issues, emotional numbness
Right.
as the pandemic moves on and gets progressively longer. And we're also seeing increased mental health crisis for those that are experiencing an acute mental health issue. We're seeing increases in substance use, people's use of drugs and alcohol. We're seeing relationship issues, particularly during the part of the pandemic when people were at home and on the stay at home order, the rates of domestic violence really went up. And just generally increased stress, anxiety, and fear. We're seeing that people have a lower threshold to stress than they did before the pandemic. And it seems that we're all a little more easily triggered and fall apart from stressors that may not have derailed us before the pandemic. We see that for many, those healthy defenses that we use to protect ourselves from being emotionally frayed have really started to unravel. And as a result, stress is we're not able to cope as well. So we're seeing just everyday stress increase, and we're also seeing actual mental health diagnoses go up, particularly with acute mental health and higher rates of increasing substance use.
Wow. Thank you, Dr. Brand, for all of that insight. It is, it's collectively, I believe, and I think I mean, you make a lot of good points on the stressors. We're all at some level having to navigate this together, and it's quite complex. Dr. Silver, what are you seeing? What are your observations?
Well, over the last 2 years, our country has been coping with what I call cascading collective traumas, one to the next to the next. So, of course, we began with the pandemic, and there were economic consequences. We have had a series of climate related disasters throughout the country. We have had political polarization, the insurrection, the events that led up to the January 6th events at the Capitol. We've had the George Floyd murder and the subsequent belated racial reckoning throughout the country. So we've really been coping with an enormous number of traumas, collective traumas. We've had mass violence, many shootings of late. We have now the war in Ukraine, which is impacting many people in terms of the economic consequences and the emotional consequences. So we've really been coping with a lot. But also, very importantly, we have lost over 1 million lives in the United States. That means tens of millions of people have lost a loved one. Millions and millions of people have gotten sick, and people, if they haven't had direct losses, had many symbolic losses. So many people who died ended up having to be buried or memorialized without their loved ones around. There have been weddings that have been postponed, births that have been without one's family around them. So we've really experienced a great deal of loss. And as we just heard, there have been many, many psychological and mental health consequences of this. But when you consider the range of experiences, I think it's remarkable that we have seen the level of resilience that we are seeing, given all of the loss and the tragedy that has befallen us over the last couple of years. I would also agree, based on research that I have conducted with my colleagues and among a national sample of individuals that we've been following since March of 2020, people are emotionally exhausted. People want to be done with this. They're through wearing masks. It's going to be very, very difficult if anybody decides that we want to put masks back on. I think it's going to be very difficult. I think that is going to be almost impossible to bring back in because people are just, as we've heard, emotionally exhausted, but
Right.
not just from the pandemic and all the other stressors that we've
Right.
encountered over the last several years.
It's interesting you mentioned all of this because at times I share with the team, we feel like we're carrying the weight of the world on our shoulders. And everything that Dr. Brand and then you, Dr. Silver, mentioned, it definitely is the weight of the world on our shoulders. With that, Peter, would you like to share your perspective and what you're noticing right now?
Yeah, I'll kind of just speak in what we've been seeing in the workplace. And, even before the pandemic, we knew that we were a lonely society. There's been a lot of research out there to support that we just have not been feeling connected to really anyone, particularly in the workforce. And so when you add on top of that the pandemic, last year, there's a lot of buzz phrases or some hot research about the Great Resignation. Half of the country last year was looking for a new job, and a lot of it was for the reasons that Dr. Brand and Dr. Silver had already mentioned. And people were leaving for a variety of different reasons. Stress and burnout was a huge component of that, but also people were just not feeling connected to their colleagues. The workplace is a significant contributor to loneliness today. And resilience in the workforce is low. And so we've seen folks who do have low levels of resilience. Some commonalities is they don't have a lot of close connections with their colleagues, and so that perpetuates a lot of other unfortunate effects of being less productive. They're not showing up to work. About 5 work days last year was estimated being lost due to burnout and stress. And so it has been a real issue for employers to figure out how do we kind of create a more connected workforce in this era of the pandemic. It's not just about COVID-19 anymore. To Dr. Silver's point, there's been a lot of fractured relationships with political ideologies, things of that nature. And so people are really struggling to find ways to bridge that gap again, to have closer relationships.
Yeah. Thank you, Peter. Dr. Hymell?
Yeah, I think to not elaborate on what everyone else has said, when we look at our workforce, we have a very diverse workforce, and they're in a diverse number of jobs. We have had cast members that have had to work on the front lines throughout the pandemic, being some of the first to reopen the resort and our restaurants. We've also had those that have been working from home, those that are furloughed, those that are just returning to the office right now. And so on that spectrum, we have just a diversity of issues among our cast members who are dealing with a variety of emotional health issues. And it's not just them, it's their families. They're supporting their parents, they're supporting their children.
Oh, yes.
And they're coming back to work, oftentimes deconditioned. We've been sitting home. We haven't been able to really be out and about. So trying to address all those needs as we bring a workforce back is something that employers are facing along that mental health continuum.
Thank you all so much for your insight. And to move on with our conversation, another question that we wanted to delve into with all of you is a little bit more detailed in terms of the benefits of having or providing mental health support to your respective teams within your respective organizations. I think we'll start with Peter this time.
Yeah, well, I think you can quite easily contrast that with what has been happening. You know, we see the consequences of not providing mental health support, whether it's with our colleagues, our family members, neighbors, but particularly in the workforce. But we see just such a high overlap of mental health challenges and mental health illnesses, the toll that it can take on the body. You know, when we've been talking about high levels of stress and anxiousness just increasing dramatically over the last 2 years, our body absorbs that. And so we can see certain behavioral health conditions like heart disease, how that overlaps with depression. So really, this is why we really want to value mental health, because it actually affects our physical health. And if we do not address our mental health challenges or concerns, it's not just going to go away, and it can develop into something more significant down the road that could be by way of a crisis or something else. And then not to mention, we want a productive, happy, healthy, connected workforce. So those are all some reasons why we really should be valuing mental health.
Yeah. Thank you, Peter. Dr. Hymell, your insights on this?
To Peter's point, health is really that balancing of mental, emotional, physical, spiritual well-being. And if we don't pay attention to the whole mental and emotional part, you don't get good health. And that is certainly something we're seeing across our population and across this country. I also think one of the reasons why mental health has been on the forefront of many employers right now is we know our employees, our cast members really do need the resources. And so we're trying to make sure we talk about it so we destigmatize someone asking for help, because oftentimes people are reluctant to say, I need to reach out to a counselor. Maybe if we talk about it, we put resources at the work site, if we make them very accessible, make them accessible through online apps or chats, it makes it easier for people to reach out when we know they're in need.
Yes, thank you, Dr. Hymell. That is, those are all good points. Dr. Silver, your insights?
And so one of the things that we know is that most people do not seek professional mental health services. So I think it's really very, very important that programs like this and other programs that serve to educate the public on the real challenges that we have been facing and the real stressors that we have been facing. And as has been previously pointed out, it's extremely important that we try to destigmatize seeking help. But again, most people do not seek help through professional mental health providers. They may seek help by going to the emergency room. They may seek help through their primary care doctor. But more importantly, they may seek help by their friends and from their friends and loved ones. And so it's extremely important that we recognize that these have been very, very challenging times, and people's experiences are normal in the context of these very, very abnormal days. The other thing I would like to just mention is that in my own research, it is clear that people who spend an enormous amount of time engaged with media stories about the pandemic, other adversities, what journalists have been calling doom scrolling, going from one bad news story to the next bad news story to the next. And this can happen without people even recognizing how much time they're spending, particularly with social media. And I think that one of the very important messages of my work is to indicate to people how important it is that they monitor the amount of time that they are spending engaged with all bad news all the time. And so, again, I think we're talking about public education and destigmatizing the challenges of the last several years and monitoring media intake.
Right. And it's interesting. I have to make a note of that doom scrolling to talk to our team about it, and ensure that we talk about all of these things, and it's important for us to make sure that we try our best to stay off of social media, specifically if it's not as positive. Dr. Brand, your insights?
Hi, yeah, I love that term too, doom scrolling. It's just so expressive and so descriptive of what we see. And just to support Dr. Silver's comment about stigma. Stigma is one of the just really, really big reasons that people don't seek support when they need it. And because they think that it's not okay, or they may lose their job or their family. There's a feeling of, I may lose something if I go and get help for myself, or that there will be shame or something around it. So helping to normalize that people are struggling right now, and then to normalize seeking help when you need it at all different levels, because we don't need to be in a mental health crisis to get help. You could just be a normal, average, functioning person who is taking care of kids and going to work every day and doing all the things, and you're still struggling and unhappy. And that's the population that often will not seek help, because it isn't as obvious to see it. But the way to really target that is to bring mental health outside of the places that are scary for people. So outside of the clinics and the hospitals and places that people would go to seek formal care, because we know that people go where to their communities when they're struggling. They go to they're at schools or academic institutions, and they sometimes will get identified there or start conversations there, or clergy or faith communities. The faith-based community is very often where someone will start to seek care or to express a concern. But overall, mental health is profoundly important to all aspects of our functioning as humans. It affects how we act, how we think, how we feel, and it helps to determine how we handle stress, how we relate to others, and how we make decisions overall. When someone is emotionally healthy, they are happier in their lives. They not only do they have a greater ability just to cope with the normal ups and downs and stresses of life, but they are more apt to be productive and to be creative, to actually be able to think creatively. You need to be healthy. They have healthier relationships when their mental health is in a better place and can contribute meaningfully to society. Right now we're in a crisis of trying to keep people alive. We know that suicide rates are on the rise, that substance use is on the rise. There's so many substances that are cheap and easy to access and very, very deadly. Like in Orange County, we're seeing a rise in fentanyl deaths, and we're seeing it with a lot of young people. And we need to really provide care where people are in their lives and outside of the traditional clinics. We need both. We need it in the community. We need people to have access in their community, and we also need people to be able to access care when they need it from where they go every day or every week, just in the normal rhythm of their lives.
Thank you all for this insightful conversation, and I'd like to add something, and this really ties to my ties to my next question, where what can you talk a little bit about? We talked about stigma, right? A couple of you mentioned stigma, but what about embracing the generational differences and the stigma behind that? That we stick to it as the generations grow and evolve. Can anyone speak to that?
I can make a comment about that. I think that so it's the right question, and there needs to be an and connected to it, because the and is the and cultural differences, and there are differences in how the different generations see mental health or mental wellness issues in general, and also how they see access to help. And there are also cultural differences in the language that people use in different cultures to describe when they're struggling. It isn't always the traditional words that we think of: anxiety, depression, stress, things like that. And often it is something that is a physical manifestation that gets described. And someone describes pain or headaches or stomach issues. And some of that has to do with the cultural language that people are raised in, and what the norm is around how they describe that. But I also think that regarding stigma, a lot of stigma can be helped to diminish a little bit if we really look at the places that people get care. Because if you look at most mental health facilities or offices, there's a similarity in look and feel to them that can be stigmatizing. It can be scary to walk into a place that doesn't look or feel inviting. And there's a lot of research, including what we're doing in Be Well, with Be Well OC, with the treatment and the wellness campuses that we're building. We're paying specific attention to how things look and feel and how people get treated when they walk in, so that the experience of receiving care feels different, and that reduces stigma. If you provide care, places where people can go and get care that look and feel inviting, that don't look like a traditional mental health type facility that you would see maybe in an old movie, where people are treated with dignity and respect, you will get people being more open to walking in and getting care there, because it feels more like a welcoming wellness environment instead of a treatment center. And I think that's true across generations, going back to your question, Georgina.
Thank you, Dr. Brand.
Yeah, I think we can expand in that area and just do better.
Yeah. Anyone else would like to add to Dr. Brand's insights? No? Great. So, as we talk about stigma and the generational differences and environments that we all walk into, in order to destigmatize the need for mental health, is how do we support each other? Are there any systems that we can take advantage of at work or within the community? Going back to what you talked about, Dr. Brand. With this one, I'd like to start with Dr. Hymell. What are things the employers like Disney are doing to take care of the mental health of their employees?
I think Disney has really put forward a number of programs for our cast members. Interestingly enough, we have a overarching wellness program. It is also called Be Well, Be Well, Be You, and that program offers a variety of resources, everything from EAP to Talkspace to Headspace to opportunities for mindfulness. Being able to connect cast members together to access those resources. We do webinars and help them learn how to use the resources we make available. To Dr. Brand's point earlier, too, one of the things that we're working on are working with our DRGs, our diversity and resource groups, because I think being able to get them to support emotional and mental well-being among their members really does help make it easier for them to feel more comfortable reaching out for the help that's available. And then we provide a variety of things that are more social, things like sports leagues, walking leagues where people can connect with fellow cast members, bring their family members, yoga in front of the castle, making use of our resources and leveraging them in ways to help our cast members think about not only their emotional but their physical well-being.
Thank you, Dr. Hymell. Peter?
Yeah, I really like what folks have already had mentioned, and I think one of the things that the pandemic really has done over the last 2 years was really expose kind of how the thought process towards mental health, particularly in corporate America, has been fractured. That being, this is their own set of issues. Behavioral health is personal and private to them. This isn't a place to talk about it, et cetera, et cetera. And what typically happens is stress and anxiety builds and builds and builds, and then there's a crisis in the workforce, and it's usually just HR who has to deal with it. So what we've been seeing and what we've been encouraging at Cigna really is to provide education and training for upper level management. We're talking C-suite or managers, because oftentimes folks will want to overcorrect and just throw everything at their employees and just expect them to utilize the services. But that still isn't happening because there is stigma in the workforce. Employees still don't feel comfortable or confident to have conversations with managers, and vice versa. Managers don't necessarily know how to have these conversations either. So what we've been trying to do is really provide more and more educational and trainings for management. We're not training them to be therapists. We're not having them diagnose anything, but just to kind of know what is it like just to ask someone how they're doing and offer some sort of support, because we typically do that in a medical sense. If somebody in the workforce, if they have a something tragic like a cancer diagnosis or a heart attack or something like that, more often than not, we tend to offer overwhelming levels of support. But when you're talking about a mental health issue, whether someone has a panic attack in the office or maybe they're showing up to work under the influence and suddenly they disappear for 45 days and then they come back, we retreat and we're a little bit more hesitant to have that conversation, and that really shouldn't be that way. We still should be able to have some good conversations. We're not prying into their lives, but just asking, how are you doing? Is there anything that you need from me? That's where we're really trying to rework some of the culture within the workforce. That the last question about stigma with mental health, I love talking about, stress can be good and healthy for us to experience. We all will experience stress. There's only so much we can do today to reduce the stress that we're experiencing. The same with grief and anxiousness. So it's important to note that mental health challenges is natural and normal. Now, of course, it can turn into something a little bit more problematic, but we have to be able to embrace that. And you're not seen as weak for experiencing a very natural emotion.
Thank you, Peter. Go ahead.
Peter, thank you so much for saying what you just said. So it reminds me so much of the casserole. What I mean by that is when someone has a medical issue, they're going through a cancer treatment or something like that, we show up and we bring them a casserole. And when someone has a mental health issue, where's the casserole? And we don't tend to bring the casserole. And part of the issue is people are afraid. They don't know what to say to someone. And I love so much, Peter, that the focus is on training managers how to have those conversations and what to say. We really need to be doing this in the workplace, and it pleases me a lot to hear that you're doing it just to train employees to go up to someone who has been out, maybe receiving care or just struggling, just to say, how are you? How can I support you? And that's not intrusive. That's bringing the casserole.
Exactly.
And it's very encouraging for people. So
I'm
thank you,
taking
Peter.
that. Where's the
Dr.
casserole?
Silver?
I'm going to take that.
I like that.
Yes, well, I'm speaking first as a researcher, but also as an administrator at the University of California, Irvine, where we are one of the largest employers in Orange County. But we also have almost 40,000 students. And so we're dealing with both the educators and the staff, as well as the students who are coming to us to get an education. One of the things that has been really clear that has been advocated by our campus administration is the importance of flexibility now. Rules that used to be unmovable have now fallen by the wayside. We've created new mechanisms to communicate with one another. We have meetings that can be done remotely. Education can be provided to people in the privacy of their own homes. And our campus is working to develop what's called the future of work. We're trying to see how we can embrace what we've learned, the good things that have happened, particularly in the use of technology and in the ability to be flexible with people going forward, such that some people will stay fully remote, some people will be hybrid. Students will be able to take some classes remotely as well. And all of this was perhaps on the horizon before the pandemic, but the pandemic definitely rushed this all forward. We are now seeing and talking about issues that probably without the pandemic might have taken 5 to 10 years. Now we have to come up with something by the end of the academic year about how we're going to go forward next year. But certainly flexibility has been one of the strongest characteristics that I've seen my institution embrace, both for faculty, staff, and students.
As they say, it's we're meeting people where they are at, whether it's faculty, students, or within our respective organizations and in the workforce. It's meeting people where they are at. Wow. Well, this has been extremely fascinating to journey through this conversation with you. But before we move on to our next question, we are going to take a quick break to hear from our sponsors. Don't go anywhere. We will be right back.
At UCI, we believe in the infinitely curious. We believe in the courageous of thought, the ones willing to fail again and again, until one day they don't. When you have the courage to see things differently, to see opportunity where others see impossibility, amazing things will happen. At UCI, we stop at nothing to change the world, to save lives and deliver the extraordinary.
When you think of growth, what do you think of? Upward pointing arrows, 5-year plans, cash flow, emerging markets, new competitors, charts, spreadsheets, presentations, proposals, industry trends, potential pivots and production delays. Or do you think about your people? Yeah, the people helping you make all this growth possible. Their growth, their health. Like Erica, whose daughter just got back from the dentist.
Hey, Mom, I got blue ones.
Oops. I'm in a meeting. Call you back.
Love you.
She got braces.
We're gonna make the most.
Or Jim, who's going to need a mental health day tomorrow.
You're gonna be. You want a little sippy cup? Hey, Mitch, does he look like he wants a sippy cup?
Or Kenzie, who has physical therapy on Tuesday.
Ow! I'm over here, guys. Now that's on the uptick, okay? Nadia, I want to commend you for that.
I'm not saying that things like the bottom line aren't important, but the real bottom line is, don't just pay for a health plan, invest in a growth plan. Cigna, your new growth plan.
Welcome back to the OC Forum. If you are just tuning in, my name is Georgina Maldonado, and I am your moderator for today's discussion. Rejoining us are Peter Freeberg, Behavioral Clinical Account Manager from Cigna, Dr. Roseanne Cohen-Silver, Distinguished Professor of Psychological Science, Medicine, and Public Health at UCI, Dr. Pamela Hymell, Disney Parks Experiences and Products Chief Medical Officer, and Dr. Lauren Brand, Executive Director of Operations for Be Well OC. Welcome back and thank you for being with us again, our distinguished panel. Earlier in our program, we discussed the values of taking care of each other and how we take advantage of several resources that exist at our work and in our community to conquer these stressful times we live in. Now that we are beginning to move past the pandemic and learning to navigate this new world we live in, I would like to ask each of you, and this one is directed to Dr. Silver, what has the pandemic taught us that we can include in our vision moving forward? What are we working on to ensure our future is a healthy and prosperous one? Dr. Silver?
Thank you. Well, one of the things that I mentioned earlier was the enormous amount of loss that people have experienced, both symbolically as well as directly. And I think that it's extremely important in that context to recognize that many people are probably coping better than they might have expected if you would have told them what they would have been going through over the last couple of years. And so one of the important messages that I think people should focus on are the coping skills that people didn't really even realize that they had. The friends and loved ones who they feel that they can reach out to, and the enormous amount of community opportunities, as we are hearing today on today's program, that are available to people to seek help if they need it, and if they don't want to do it by going to a mental health professional, there are many websites and many nonprofit organizations and many educational institutions that can provide some assistance. So I would say we have survived this terrible trauma, and I think that we must recognize that we probably are doing better than we even realized. I think having compassion for one another and reaching out to friends and loved ones when we can are ways in which we can continue to connect as we come out of this terrible 2.5 years at this point now.
Dr. Brand?
To remember that we exist in a lot of different environments, and all of those environments impact our experience of the pandemic and impact our mental health. Just talking about the working environment, think about how many hours of your week you spend at work, and because it's such an enormous part of our weekly experience, it's not typically something that we don't typically think about work as being a place where mental health happens. We typically think of it happening out there, somewhere in the rest of our lives. And so many workplaces still have the expectation that employees leave it at the door when they come to work, and then they come in and be employees. But during COVID, work and home became very integrated. So for many, that still hasn't changed because hybrid work environments are now the new norm. The concept of balance or work-life balance, I think, has become outdated. We need to think about it more now as integration. And mental health is about healthy integration. So I think employers thinking about employee health and wellness in the context of mental health is really, really important. And I think that workplaces can be a primary place where people can get support for mental health. Getting mental health support is really about getting the right support at the right time. And for those that are in a crisis, there's the right support in a different location for that everyday mental health and the wellness that just helps us to function better in our lives. The workplace can provide a really critical type of support. I think that the concept of integration is really important because when you think about mental health being something that is integrated into both life outside of work and life at work. This is where the concepts that have been, there are a couple of people that mentioned flexibility and workplace flexibility. And that is a very core part of thinking about that balance of work and life integration. A lot of workplaces provide wellness programs where they have a lot of great resources, some just on paper, and some are, a lot of things Pam talked about, where she's talking about doing yoga and things where employees are participating together. A lot of workplaces forget that they have to actually carve out time or help workers to have flexibility in their day, just during their day, not necessarily outside of work, to include mental health practices. So thinking about how do we create workspaces that promote time for things like this. So things like, look at how we assign new projects to people. Do they actually have the bandwidth to take something on and still have time to participate in the mental health or wellness offerings at the workplace? Are deadlines reasonable or realistic? Are projects assigned based on someone's actual strength areas so that they can function and get the project done really quickly? And is there tolerance in the workplace for people to step away or modify their workday so that they can grab a hold of the resources that the workplace provides to them? And then when people are beyond that and in that crisis place where they're actually not functioning at work, for the workplaces to connect with an organization, maybe it's Be Well Orange County, or there are other resources across the county as well, where people can get mental health care in the right setting, not an emergency room, but in a place that is really designed for mental health or substance use treatment that specializes in that area, and not default to the medical system to get help for people. But I think workplaces create wellness activities, but don't think about when the employee is actually going to have time to access that.
Right. Thank you for that, Dr. Brand. Peter?
Yeah, just to kind of, go off of Dr. Brand, we spend about 90,000 some odd hours of our lives at work. Some of us feels like it's more than that. So our coworkers are kind of like a second family system, and like your original family system, there may be some colleagues you don't necessarily get along with, but we do have to have some sort of connection with our colleagues. When we're talking about building some sort of initiative, having something where you can feel more connected at work. So when we're talking about just this vision moving forward, realize we can't do this alone. We've tried to go about our own mental health issues or stress alone, and that just has not been working. So really, when we're talking about just clever, creative ways, I know Dr. Pam had mentioned some great initiatives. I'd love to pick her brain about things that they've been doing over at Disney, just to have folks just feel like they're a part of something greater than themselves, and really having a common vision.
Dr. Hymell?
Yeah, I want to spend a minute and talk about flexibility, and flexibility maybe in a different aspect. It's how you provide access to that care, because people might not need to go in and see an individual at a point in time. Maybe there's a way, telemedicine, that we've all learned how to connect via virtual platforms could be a better way to access care. There's chat, there's also online access points. But I think the biggest issue that we see as we look at, how do we get a vision moving forward, is how do we get better access? Because oftentimes, even in these moments of crises, someone is given an 800 number to call, and then you reach that 800 number and you get 3 providers and those providers are full. And then what do you do? And you start from ground zero. I think that's one of the opportunities we have in the community, is to figure out how we can get access to those providers in a different way for our community members and our employees across Orange County. And how do we get them different access points into that healthcare community?
Right. A holistic approach to access to behavioral health services. That's what I'm taking away from this question. And I want to thank every single one of you for your responses. I know you live this every single day with the clients you see, your the research that you do, and I know we wholeheartedly want to continue to be there for each other. And unfortunately, we're running out of time, but before we end our discussion, I want to close this conversation with this question. If you could wave a magic wand, what is something you would do to help others conquer stress? I will go to Dr. Silver once again.
Well, I'm not a clinician, so that's a difficult question for me. I think one of the things that I would say is that we give ourselves permission to feel both positive and negative, to recognize that this has been a very, very difficult time. As we have said throughout this conversation, this is the responses that people have had, the ways in which people have coped have been normal under these terribly abnormal circumstances. And I think if I could wave a magic wand, it would be to get the 1 million people who we've lost back. That number to me is just so amazingly tragic, and I don't think that we expected or anybody could have wrapped their head around this level of tragedy 2 years ago. But now that's where we're at, and I think it's important that we give ourselves a break, that we engage in self-care, we give ourselves time off when we need it, we try to eat well, sleep well, get exercise, and stay off the bad news.
Thank you, Dr. Silver. Peter, your thoughts?
If I had a magic wand, I would want to give everyone an overwhelming abundance of patience, just patience with themselves, patience with others. Just to go back to Dr. Silver's doom scrolling, we do kind of get in this state of angst, and we're not patient with one another. And we don't have a lot of grace for one another and or ourselves. So just having just this overwhelming sense of, hey, let's not jump to conclusions. Let's not beat ourselves up over something. And especially when you're talking about forming healthy habits, a lot of us say, hey, I want to lose 10 pounds, and we're upset if we don't do it by tomorrow, and so we quit that goal. So just kind of being patient with life is what I would love for us all to have.
Yeah. Thank you, Peter. Dr. Brand?
My biggest concern is the continuation of people working remotely. I think that there are people who are wired to work remotely and do well. The pandemic has given us the gift of people feeling comfortable on a virtual platform, and that has allowed people from all over the world to connect in a way that we really haven't done before on a normal, regular basis. And now that people have the option to go back into the office, I hope that workplaces encourage that in-person connection or hybrid instead of a fully virtual work type of environment. We're social beings. We do better when we are in connection, and working remotely on an everyday, day in, day out basis is very isolating. And we lose some, for younger people, there is a social skill building that gets missed without in-person connection. I think that my magic wand would be to ask everyone to take a moment and just stop and be still and just be instead of do for a moment, and take a breath and come away from that breath with an attitude of kindness towards people, because yes, we have been very resilient. Dr. Silver's point, there has been incredible resilience that has come out of this pandemic, and we need to focus on and honor that. And we have an opportunity to really know that there are a lot of people also struggling, even the resilient ones, and to just treat people with kindness and respect and patience. Patience is very important. I like that too.
Dr. Hymell?
I love what everyone had to say, and I think the whole concept of just taking a breath and being able to enjoy the moment is something that many of us have probably forgotten how to do. So reconnecting is an important element. I also think that one of the things I would love to see coming out of this pandemic is better access to care. And I know that many people left the workforce. Many people are looking at what a different career opportunity would be for them. Wouldn't it be wonderful if there were training opportunities that we could get more individuals trained in helping and support others in pursuit of just self-care and mental health care? I would love to see us be able to support that training in our community and really encourage people to look at that as a career path going forward to help augment the lack of resources that may be out there in the community to help all of those who are in need.
Thank you so much for your inspiring words. Each and every one of you have contributed significantly within your workforce and within your level of responsibility, and the information that we're sharing here today. I hope that we all take something away with us. I know I have, which is the doom scrolling. It was my first time hearing that. I've learned about it in different words, but thank you very much for being with us. I truly appreciate it.
Thank you.
Thank you.
Thank you.
And thank you to our viewers for tuning into our program today. I would also like to thank our title sponsors, UCI and UCI Health, for making this program free for everyone to enjoy. For more information about this topic and to view our previous conversation, please visit our OC Forum website in the description below. Thank you again, and have a wonderful day.